Hi, this is Dr.Supriya. Now let's discuss about the organ of nutrition, that is placenta. The placenta is a discoid organ. It is almost like a thick crust pizza. It is attached to the wall of the uterus and the fetus via the cord. The umbilical cord contains 3 vessels, 2 arteries and 1 vein. The placenta usually performs the functions of liver, kidney, lungs and endocrine glands throughout the pregnancy. In the first trimester, the structure of placenta is different from the latter part of the pregnancy, as after 14 weeks, it takes the function of secreting large number of hormones to support the growth of the uterus and the fetus. Generally, the placenta implants in the upper part of the uterus on one of the wall or in the dome of the uterus. However, occasionally it can implant near the internal os, that is, at the opening of cervix. It is more common in the women who had previous cesarean sections and it is called as low-lying placenta. This generally migrates upwards and usually do not cause any difficulty further. If it covers the internal os and unlikely to move upward, then it causes bleeding during pregnancy. It may adhere close to the muscle or wall of the uterus and may cause bleeding even after the pregnancy or delivery of the baby. When placenta adheres to the muscle or wall of the uterus, then patient may require cesarean section in well-equipped hospital with availability of blood transfusion. The placenta separates from the wall of the uterus after delivery of the baby. This is usually due to the decompression. It is heralded by the sudden gush of blood and change in the height of uterus with an apparent lengthening of the cord. The delivery of the placenta is usually termed as a third stage of labor. It usually occurs within 15 to 30 minutes after delivery. This can be helped by giving oxytocin. The oxytocin is a hormone which promotes uterine contraction and letting down of milk and gently encouraging the separation of placenta by pulling the cord down and the fundus of uterus upward. This prevents excessive blood loss in the third stage of labor. The cord need not to be cut immediately after the birth of the baby unless the fetus is distressed. This allows a fair amount of blood to be delivered to the baby from the placenta. The placenta is a reservoir of blood for the baby. This is especially important in the preterm babies. Several drugs, viruses and antibodies crosses the placenta to and from the fetus. It is therefore not a foolproof barrier. The fetus may be affected by the infections contracted by the mother such as toxoplasmosis, CMV, rubella, etc. The fetus also affected by the drugs she takes and the antibodies produced by the mother. The mother can produce antibodies to the fetal red blood cells in case the baby is Rh positive and the mother is Rh negative. The baby is usually Rh positive when the husband is Rh positive. Therefore, instead matching horoscopes, one should match their blood groups. The placenta and membranes can be infected by the bacteria or viruses in case of ruptured membranes, and this may lead to maternal complications beside fetal compromise. So, by this we finish the detailed description of placenta.